Good evening. I think most of you will be thinking I'm the guy whose anchor never left the pot. It was easy for someone to say, pull the anchor and go and find a new pot. And it's not always an easy decision for any one of you, I can tell you that. It's not easy for me to move from government to private after 18, 19 years. So my question will be, have you looked hard enough around your pot? What can you do with what you have? And do the best with what you have. So yes, my whatever anchor was rooted deeply in medicine, but I made it very long. So I went around with the point. And I never left Seremban. That's how much my anchor was. Can you imagine? They told that I'll give you a promotion to JUSA, go to Sungai Buloh and HKL. I told you can keep the JUSA. I will stay back in the thing. Because when you pulling the pot, you must understand there's a lot of issues you need to decide. So for me, happiness was one of it. Being with family was one of it. So that's why my anchor was quite rooted. So I'm here to talk about research. Many of you say, oh my God, research is not my thing. But if you're a doctor, everything that you will learn is through research. The treatment that we give to every patient is through research. It's like having 5 fingers and you're telling you can eat with 1 finger. Research is the 4 fingers of medicine. So I just want to go through with you the evolution in Malaysia. For surgery, I'm sure the basic sciences, Dr. Wu Liang Teh, all these guys are there. But in surgery, these are the people who is used to be my mentor, whether I read about them, I work with them, and have meetings with them. So let me go through with you what happens in 60s. So you understand what's going to happen in 2020 to what's going to happen in 2030. You will know if you understand the evolution. So before 70s, there were surgeons from overseas. There were not many surgeons who are Malaysian. One of the few surgeons in Malaysia was Muhammad Said. I think one of the senior, if you see the bottom there, first surgeon who became a politician and became the first member, Menteri Besar, of elected Menteri Besar. Before 70s, when the Malaysians became surgeons, they used to see a lot of things which is local, but not in the books of European books. They used to see all these tumors which is big, and they don't know what is. And they wrote about this. They wrote case series, case reports about this. So you can see the studies during 60s and 70s. It's all about case series, case reports about this. Now, nobody wants to do case series and case reports. They say it's not important. But it's still important to pronounce. So he used to write. This guy loves to write. And when you go to same era, then came Prof. Bala. Prof. Bala is another innovator. Being a medicine, you have this curiosity. And the whole world were looking to find how to define vessels in the liver, how to research for vessels in the liver. So America were trying to break the liver. Once you break the liver, gone. You cannot read it. So Prof. Bala, being in Seremban, he went behind the hospital where got rubber trees. All right. He took the rubber, took a dog, dissected the dog, inject the rubber into a liver, and then keep it for a few minutes. Once the rubber is hard, take the whole liver, put in the formic acid, and dissolve the parenchyma of the liver, and made the first liver cast in the world in Seremban Hospital. Okay, and then the US gave him an award, Jacksonian Award in 71. and they did all this coloring. That's how it started off, the liver casting and all the cornite plotting and all the hepatobiliary surgeons. And then 70s was, I know how to cut, but can I cut faster? Why you need to cut faster? Because patient bleed. If you bleed, you die. Okay, so they say, if I cut fast, patient survive. So there came innovations where they stopped the bleeding. If your liver bleeds, we put a clamp it. So this was created by Prof. Bala as well. Until now, you can see this in Edinburgh Museum, Bala's clamp, they call it. And he was the first one to put forward that Malaysia need ICU. Okay, because we need critical care for the patient who bleeds a lot. And from his team of MOs came about all these guys. Yusof Said, it came about TKT, you got Prof. Kanda, who many of you know until now. So these are the mentors from him. So you can see why I'm talking, because mine was Prof. Kanda. Okay, so and then came 1980s, where they say, let's make the incision smaller. We are cutting whole thing here, and they say make the incision smaller. We call it mini laparotomies, mini cholecystectomy. They want to make it smaller so that the patient don't have more pain. They won't have much bleeding. The wound infection is less. Then came 90s, where they say laparoscopy. Everybody wants to do laparoscopy. Somehow in Malaysia, 1990s, it didn't pick up. Didn't pick up at all, because obviously we don't get the funding to buy. Okay. Number two, the systems are so poor that we cannot see things better. Only in 2000, I would say in early 2000, when the cameras are getting better, we see better structures, the anatomies are better, we learn all these things better. And this thing boomed in 2000. That's what we are having now. And later on, I told that there are going to be rise of machines. That means robots will operate you, for sure. You're going to be just near future where you go and stop by somewhere like a drive-through Starbucks and then told, please remove my prostate. There goes. Robot will come, remove your prostate, and you drive out. Okay? Might happen. But at that time, I was so curious to learn laparoscopy, but nobody gave me the chance to do laparoscopy. They say, the most senior consultant must do the laparoscopic surgery. You, MO, cannot touch. But you must understand, we, or maybe you all are younger, we play computer games. All right? Our learning curve for laparoscopy is much higher. Maybe your computer games is PS4, PS5. My computer games is the olden day one. No, have you seen? The one used like this joystick and 3 buttons. So we are much better at this. So what I did, I tricked my consultant. I told, can we do a research? Since you want to publish papers, I do research. We compare 3 MOs, you teachers, see how long it takes for you to learn laparoscopy by the new MOs. So during that, we did a study with the 3 MOs, and that 3 MOs got a chance to learn laparoscopy without the consultant knowing. Is actually passing the knowledge to us through research, and that's how we started the largest appendix series in Malaysia. And then we carry on that PET scan came about. Everybody was so hyped up about PET scan. But when we look into the simple things about laparoscopy, this term about lab staging came about from this paper. It is still highlighted until now, where as a MO or house officer, we go in, open, they say, wow, this cancer advanced. Hey, Maha, you close and come back. The consultant is going to eat, you'll be closing the whole abdomen. Then I told this consultant, why can't you put a laparoscope? Since you already have a laparoscope there, put a laparoscope inside. See, it's advanced. Then you save the time for me to close what, right or not? And only 2 holes to do. So when we did the study on lab staging, this was cited by North America clinics, this paper, that doing lab staging, I actually save patient from having a laparotomy scar. that I actually can reduce the scars. So that's how this term came about. Then, of course, I used to read about our DG, who's another innovator. He reads and does all his cases. In Malaysia, we get big thyroid cases. So he came about this score called Putrajaya's classification of retrosternal goiter. I thought if he can do classification, maybe I also can try something. So since I was upper GI interest, what I did was, we used to get all the cancers late. You know how many stomach cancer patients and esophagus survive more than 3 years? Not many. So that's why I embarked on how to get the patients to come to scope fast. So I told my consultant, the problem is that the patients come 30 weeks after the first symptom to scope. So I told, why can't they come earlier? That's when I told them, why can't we do it in 2 weeks? This is what they wanted to kick me out of the department. I say, how can you change a KKM system of referral by bypassing SOPD? So we did that somehow. That's what you mean by making use of what you have. And we created this score to ask KKM Klinik Kesihatan to refer straight to scope room. No need to send to the specialist. You got this score more than 10, you send. This is what we won the awards for. So this is where it started, the research and all this thing. We went to Japan to present, and after winning, Professor Yamamoto. Yamamoto is the guy who created double balloon endoscopy in the world. So it took me aside, I think, and he wrote a paper together. And this is a Grand Master of Endoscopy, Prof. Ken Haruma. I was the only fellow that he took before he retired. He usually don't take international fellows because he cannot speak English well. So he's going to retire. So he told, why don't you take one? I was a lucky Indian fellow. Okay? And so what is important is what's going to be next. Some say no cutting. No cutting. Some says no scars after 2020. Do you all agree? Surgery will have no scars. It's already there. Gamma knife for brain surgery have no scars. It's almost there. Nodes going through normal orifices for surgery have no scars. Okay, it's already there. But it goes beyond that. You need to go beyond that to be innovators. What I'm getting at is, when I went to Berlin to represent Malaysia, I saw normal medical officers coming up with ideas. I saw nurses coming up with ideas. And what happened was the winner of that Berlin innovation thing was a 25-year-old MO who came up with the idea, the suture can change color with the tension. And B. Brown bought the patent for 20 million on the table, on the spot. Okay? So he became 20 million richer over dinner. Okay? And I asked him, wow, you just sold the patent. He said he got 8 more patents with him. That means he got another 8 ideas with him that he can sell, but only this is where he got it sold at the night. So, of course, I didn't get much money because I'm only a country winner. And I had no engineers. They came with material engineer, they came with design engineer. I went with my wife. Okay? And my wife was shivering, say, what are you writing it about? Because at least if they ask me, I know what am I talking. So I wrote about film suture with multiple layers for eye surgery. Okay? Eye surgery is not my field, my wife's field. So I used to look into this thing and say, hey, why can't you do this? So I wrote about eye surgery. And if you look into other eye things, because I used to see this at home. If you've seen this OCT in eye clinics, then I say, why can't you do OCT for stomach? No, you can do OCT for esophagus. So when you look into it, let me tell you, if you have any innovation in your mind now, somebody would have thought about it. Somebody will think about it and will come up with a product if you don't act on it. This thing, I was thinking about it, and when I went and researched, they're already doing it in the dogs. They're taking the eye thing and putting in the stomach. So what does it tell us? That similar thing, this is the esophagus. If you look at the branches, many of you have seen this, but this is where it comes. You have the talent, you have the skill, you have the knowledge. Looking at the pattern, I draw these kind of things every time when I get curious. And with the pattern, you see that when the pattern changes, they get Barrett's. When the pattern changes, they get cancer. That's all you need to know, the pattern. So I drew the pattern. And this Japanese guy who saw this, Prof. Haruma saw this, he said, you can kick a Japanese guy's ass with this. No? Because he said, nobody actually take time to draw this thing. And I told him, I can go one step further. You know what is this? Retina scan, right? You inject dye in the retina and then you take photos of a retina. I told, if I can do this in endoscopy, I'll get the same pattern of my junction. And I no need to scope anymore. I take a esophagus picture and I can detect cancer without you even doing a scope by pattern recognition. Okay? This is now developed by Karl Stoss. We are planning to do this with Karl Stoss. So, with curiosity, I used to take my MOs. I think one of guy was here. I think I used to take them for study tour. We call it slaughterhouse. It's a pig slaughterhouse. I think Elvin were here just now. So I told them we had two patients who came with burst abdomen, burst stomach. After dinner, they went to drive, staring hit, and he burst. So my question was, where is the weakest point in the stomach? Where is your weakest point of the stomach? We asked. Nobody can answer. So I said, let's go and find out. So we took them to this pig slaughterhouse, and I told these guys, give me stomach and esophagus. So what this slaughter fellow did, he threw the whole thing. Potong sendiri lah. So we potong, put coke, put polamine. You know what will happen, right? You'll create gas, water inside the stomach. And we tested with this thing. And the guy who's sitting down is the aesthetic physician now, I think. Quite a famous guy. Not him, but another guy. Okay? And that is Elvin, who was here just now. Ask him to burst. This is the abdominal wall, which is a board. We have a spine, which is a bamboo. And we burst every one of it. And he burst at the same place for all the stomach. Same place. It is not at the fundus. It is not at the antrum. It's the greatest curvature, the extent. And when he examined, when I stapler and then want to read, found that the extent of the repair need to be good. If not, it causes necrosis and burst again. So you need to repair a bit deeper because it retracts, mucosa retracts. So this is what experiment can give you. Because when I now go to repair stomach or remove stomach, I know when I have this thing, I need to repair differently. So why research, if you ask me? I gave you so much examples that it creates new treatment arm. It creates new medicine. There's so many things which is not answered. There's so many things evolve every year. You have the skill, you have the knowledge that you studied. New treatment going to come with COVID. So many things which is new. Every day we are learning new things with COVID. There's new disease going to come next year. Who knows? The new technique of surgery going to come. So the development going to be something interesting as well. Audit on practice. If you don't do research, you might do audit. Some of your seniors might say, I'm running a clinic. I still need to know how many patients I had came with URTI. I still need to do some kind of audit to improve my clinic. I need to do some kind of audit to improve myself. You need self-education with research. If you think I have studied enough of last 5 years. Self-education is always there. If I'm treating a patient today and I found that this patient, what was the recent thing was, I had 2 patients with intestinal obstruction. And when I opened the small bowel, it was all this soft jelly-like things, like cork, okay? And when I went back and asked this patient, what did you eat last 1 week? She told, it's a Hindu fasting month, so they ate only vegetarian meals. So she ate meal replacement, the mock chicken. She hanta mock chicken for the whole week. Okay, so the mock chicken got tissue glue. You know, they use tissue glue to make the mock chicken. They mash it up. So when you eat and the thing goes in, it sticks back together and become like a cork in the distal ileum. So 2 patients came with the same mock chicken and stuck there. Self-education, you need to know how you're going to now tell the patient that tissue glue may be the problem. Can I make a new tissue glue and sell it off as commercial value? That this tissue glue is safe. What you're having is wrong. So that's how you're going to learn from whatever is happening. Same thing, another old man came with a shiitake mushroom. He ate and then got stuck. Then I say, why? He's old man, he don't have dentist teeth to chew, so he swallowed the whole thing. So self-education is important. Career advancement, of course, many of you might have heard. Those who did research didn't get permanent job. Those who did poster didn't get permanent job. It might discourage you from doing research. Why should I do research? Do posters for my MO, and at the end of the day, you get nothing. Okay? Don't get cheated into collecting data. Okay? Many of house officers and MO are used for data collection and never given recognition for your work. Okay? Anytime when they ask you to do research, be bold enough and ask, what am I in this research? Am I the second author? Am I going to present? Am I going to write? What are you? You are a doctor. You cannot be a research assistant to collect data only. You need to get given credit. I feel posters are useless in terms of research. I have hundreds of posters done, okay? But none of it I can remember, okay? And it's not going to give you value. New career, yes, this is what I think going to be interesting. What is it in the new career that we're looking at? Doctors like me, I have a lot of ideas, but I got no writers. Okay, so you know who writes for me now? You know who writes for me? IMU. All right, IMU professors, whoever getting professors, they get professors because I give them ideas to write. I don't want name. You can put my name last also can. You don't put my name also can. But I want to see my idea coming through. All right. So medical writer is something important. If you have a skill to write, okay, as a part-time, if you're a doctor in a hospital, be a writer, write for people. You know, writing papers can give you thousands. All right, one paper. So if you're a good writer, you might just do that as a part-time from home. You no need to go and see anyone. You can be a writer. Japanese. None of them can speak Japanese. You know, the team I gave. But they produce 18 to 20 papers per year. How? They use writers from Australia. They pay the writers. Okay? Their data sent to them, they write and they pay. It's a big money in Australia. Audit expert. If you are no good at auditing, they hire you to come and audit their clinic. They can hire you to come and audit their hospital. You can be a audit company for medical, for ISO, for MSQH. So many. Now everything they want to have some license and auditing. You can be expert in audit. Medical corporate R&D. Do you know that every corporate companies, I give you an example, Osram, BMW, or whichever they think, they want to go into healthcare. All right? Can they ask their engineer to do healthcare? Oh, I saw the paper. So you need doctors to come up with the ideas. So they are now looking for people who can be in the R&D to come up with ideas. They need doctors who have knowledge to know that this is certain disease. I cannot train an engineer to go and learn 5 years of work. I rather train a doctor to know about certain things, about engineering, and go forward. It's easier. Research assistant. I'm not talking about research assistant at what Houseman and MO does. I'm talking about research assistant for big professors, big name. I was a research assistant of Prof. Kanda. Okay? I'm a research assistant, but look what happened. He don't want the name. He said, Maha, you write. So now what happened? I don't want the name. I give it to whoever comes. Whoever elective students after graduation, they come and attach with me. I ask them to write. You put your name. Before they start their housemanship, they have a publication. Last few years, I did that. And these guys are already in universities as a junior lecturers. CROs, Clinical Research Organizations, there are many CROs in Malaysia, in the world. CROs are the company who does industry-sponsored trials. They have a lot of job opportunity for doctors inside there. You can take up, like contract evaluator. You can go feasibility study. You can do what they call editors. You can do a site investigator. So if you like traveling, maybe you look into CROs. They can send you to certain country to do research and come back. Okay, short term. Medical device innovator, yes, it's good. And if you see medical device, it is booming. This is the one that everyone going into now. Every company going into. And if you look at Japan, they are targeting trillions of dollars on treatment type medicine. They are looking at diagnostic type in billions of yen. The money is there, it's booming. If you look into your mutual fund or anywhere, everybody creating healthcare fund and ask you to invest. Why? This is it. So if you look into, you can be an innovator and entrepreneur at the same time. You can be. You select the route and move. I give you an example. Junctional tumor of esophagus. Every day I put in scope and say advanced tumor, I put in a stent, and then the patient comes out with pain. When they lie down, it's painful. Stand up is no pain. Lie down is painful. Then I call the Korean company and say, your design is wrong. Then he said, you know what? Whole world we supplied, you are the only doctor complain. So the fellow came down from Korea and said that, what's the problem? I say, you see, the junction is shaped and turning to the left. All right? You give a straight, rigid stand. When you lie down, cardiac is pointing up or down. Cardiac, not the stomach. The hiatus is points upward like this. If you do surgery, you know. But these guys who are in the thing, they won't know it's pointing up. So when I lie down, you're going to poke my stomach. Okay? So I told them, it need to be something this shape. I gave them this drawing, need to be this shape, and the thing need to be moved so that it moves with the patient. All right? So that's where they went and designed the thing for me, the prototype. And this is the prototype, and we put it into the stomach. Okay? So your innovation can be realistic enough to be one new invention. So similarly, in Malaysia, we have so many funds you can go for to go and get your ideas become truthful. But sadly, all these are government linked. It's under government. So when it's government linked, they won't have target, they won't have KPI like private hospital. I'm a medical director, so the chairman say, I need 8 million per month. Okay, so I need to push my revenue for 8 million. These guys won't have that. Your Pengarah hospital won't have the motivation. That's why all this validation study, you see 2014 they gave this, until now they didn't change. Okay, so this thing need to change. What we are proposing is private medication innovation hub. This hub, which we are trying, hopefully will have a Silicon Valley in Malaysia. We'll have venture capitalists, we'll have medical device giants coming in, we'll have non-corporate companies coming in. We have innovation university where you can do postgrad. Maybe you no need to leave government, part-time, contract, good. I take the money from the contract, I go and study part-time, postgrad, I became an innovator, thanks to our government to give the money, right? Study, weekends, come up with the ideas, no need to go anywhere, just type 1 or 2 papers, you create the idea. Once the idea become a good idea, open a startup in the hub, and you have your own company. You can be a contract MO for life also, no need to worry. Okay, so don't think that you cannot innovate around what you have. Okay, certain things are possible. And what to do now? What can you do now? I think all of you need some knowledge and training. If you never did research, never had a chance to think of ideas, I think Medic Footprint should do it, or you go to IRC to put it, that you need to know how to brainstorm for ideas. You need to know how to come up with the research papers. You need to know how to write a research question. You need to start engaging with all these people, CROs, ICR, Institute of Clinical Research, CRM. Go and talk to them. Look out for the hub. There are few hubs already up. Ireland, Singapore already have the hubs, private hubs. So Michigan have a hub as well. Postgrad innovation is going to be there. I think few international, foreign universities already have this postgrad, which you may be able to take it online, okay, while you are doing the contract work, which uncertain. You never know. After doing postgrad, you might jump to that country with whatever knowledge you have. So, for me, doctors are the best researcher. Full stop. Because no one understands the patient just like us. New talent need to be nurtured. Sometimes you need to nurture them. You need to support them. You need to train them. Clinical research and innovation is severely undervalued sector in Malaysia. They don't know that this is $1 trillion business. And obviously we need a one-stop center which is privately owned, privately run, so that it can run with some focus and KPIs. With that, I thank you guys. I think Ariva told that you can't see the, what they call, where destination because you are this platform. It's always good if you can stand on some shoulder of the giants. And that's what Isaac Newton told.
Hi everyone, my name is Dr. Crystal and I'm excited to announce an upcoming workshop organized by Medic Footprints Malaysia, which is called Switching Careers for Doctors. How do I know what's right for me? This workshop will be held on the 14th of January 2023 in Klang Valley, where I will be speaking alongside well-known speaker and trainer Capt Ariva. In this workshop, you will learn about how to understand yourselves better and in turn gain more clarity in finding a career that is right for you, that is aligned with who you are. Here, you will also learn about how to shift into your ideal self and create your desired reality. You will learn about becoming more aware of your fears, doubts, limiting beliefs, and how to overcome them. And lastly, you will learn about goal-setting techniques in order to reach your goals. Who is this workshop for? This workshop is especially for doctors who want to discover their unique self, so that they can find a career and ultimately live a life that is aligned with who they truly are. So if you're a doctor and you're feeling stuck or overwhelmed in your current career, and you want to venture out into something that is more fulfilling and meaningful, but you don't know what to do, then this workshop is for you. Tickets are now up for grabs, so hurry up and purchase your tickets now because seats are very limited. I'm excited to have you on the workshop and I will see you then.